led by Cook Children's, is honored to bring you this training on the current status of child abuse and neglect in Texas. Child Protective Services is often criticized, but no person or system is perfect, and CPS is tasked with one of the hardest and most heartbreaking jobs. They take no joy in removing a child from their home and have a number of resources and services they provide to keep a child with a caregiver, if at all possible. The child's safety is the core goal of their efforts. Abuse does not happen in a silo. There are many factors and variables that lead to a child being a victim of abuse or neglect. Being a parent is really hard, especially with additional family stressors such as unaddressed mental health issues, previous trauma, as well as lack of resources or support systems. The ownership for protecting the children in our community falls to each and every one of us. This is why we are so thankful that you are taking the time out of your day to learn more about this issue.
My name is Robin Chavez, and I am the CPS liaison up at Cook Children's Medical Center. Today I'm going to be doing a presentation about CPS and the state of CPS in Texas right now. CPS's mission is to promote safe and healthy families, protect children and vulnerable adults from abuse, neglect, and exploitation. Some of our values are: we are accountable, respectful, diverse, collaborative, and professional. Our vision is improving the lives of those we serve. The chief goals of CPS are to strengthen and stabilize families so they can safely care for their children at home, reduce the length of time children remain in state care, and improve the quality and accountability of foster care. What we do: Child Protective Investigations Program investigates reports of child abuse and neglect in the home, in child care, and in public schools to protect children from harm now and in the future. Most of the cases we investigate involve children living at home with their parents or guardians. Our main goal is to work with the parents to help them get the resources they need to be able to resolve any issues or concerns that were brought to our attention, and to try and prevent serious harm or future CPS cases. Sometimes when there's a serious case and the child has been abused or neglected at home, we will transfer the case to Child Protective Services for ongoing services. If there is an immediate risk of harm or something serious going on, we may remove the child from the home, and then the family can work services through the department that way. Some of what we do is also help recover missing children and combat human trafficking. So state law requires anyone who believes a child is being abused or neglected to make a report to CPS. This applies without exception to individuals whose personal communications may be otherwise privileged. This includes attorneys, clergy, medical professionals, social workers, and mental health professionals. The hotline number to report abuse and neglect is 800-252-5400, or you can always make a report online. Just remember that if it's something that's serious or needs to be responded to right away, it does take a while for those online reports to make it through the system. So we ask that you call those into the hotline and not make online reports for those types of cases. If you're a professional, you do have 48 hours to report abuse or neglect once you learn about it. And it is important to understand that if you are a professional, you cannot delegate another person to do this for you. You have to do it yourself if you have the information. So something you can expect after a report is made: it will go to statewide intake first. Statewide intake will then decide if it needs to be routed to the field for investigation. Investigation will also take a look at the report to make sure that it is something that we are sanctioned to investigate. And if we can't, it would be shut down. But if we can, then we would go ahead and investigate it. Sometimes you will get calls from multiple people Just keep in mind that it does go through several channels, so you may be talking to people about the same thing over and over again, but it is really important that you talk to these people when they call. Some of these people that may call you would be an investigation supervisor, the worker would be calling, and sometimes we have a screener that calls. The screener is just someone that a case goes to if we're not sure if it should go to the field. So they kind of make some phone calls and do some things on the back end prior to sending it to the field if it does need to go for investigation. Keep in mind that we are not allowed to disclose reporter information. So if you do make a report to CPS, it is confidential. The only people we would share information with would probably be law enforcement if we're working a joint investigation with them. We are tasked with making contact with the family and children between 24 and 72 hours, unless it's an alternative response case, in which case we would have 120 hours to make contact, and you will receive a letter when the case is closed. So here are some numbers for reports of abuse or neglect in Texas. As you can see, we get reports from all kinds of different entities and people. Usually in most years, these stats are for fiscal year 2020. Most years school would have been the #1 reporter, but due to COVID and the virtual learning and children staying at home to go to school, there weren't nearly as many school reports as we normally see. So medical professional was actually the top reporter for abuse and neglect in fiscal year 2020. You can see that we've got listed out the reporter information or the reporter entity, as well as how many calls that reporter entity made, and then the percentage for the total of abuse and neglect calls that were made. Some common ones, like I said, would be the school, medical personnel, law enforcement, and then we do get a lot of reports from relatives and sometimes other parents. So this is just a breakdown that you can see where the statistics were for the fiscal year 2020 of who made reports to CPS. So the total intakes for the state of Texas for 2020, you can see at the bottom, we had a total of 272,248 reports made. Of those reports, about 47,960 were considered priority none, which means they did not make it to the field for investigation, or they made it to the field but got shut down by a supervisor or program director or somebody of that nature because they did not meet the criteria to be investigated. We had 51,840 priority one reports, and we had 172,448 priority two reports. When a report comes to investigations, we will contact the reporter, like I talked about earlier. We will also go make contact with the children, interview the children. We interview parents, anybody else that lives in the home, whether it's friend or family member, other kids that may live in the home, basically anyone with knowledge about the family or knowledge of the incident that occurred. These interviews help us determine if child abuse or neglect happened and if there is further risk of harm to the child or further risk of abuse or neglect. We do work jointly with law enforcement on certain investigations. So if there's a criminal aspect or a criminal incident that occurred, we would work those jointly with them. It's important to know that even if abuse or neglect is not found, we can still refer those families for services and parenting classes, resources in the community if we feel like it would be beneficial to the family. We also do things like assist with rent, utilities, and childcare, stuff like that, when we do have families that we come across that are in need of that. So the various dispositions for abuse or neglect are going to be reason to believe, rule out, unable to complete, or unable to determine. If we find it reason to believe, that just means that we found, based on the preponderance of evidence, the abuse or neglect did occur. If we rule it out, that means that based on what we've come across, we have enough evidence to suggest the abuse or neglect did not occur. If it's unable to complete, that's typically used when families move or flee, or we can't find them and we haven't been able to really do an investigation or gather enough information to determine if anything happened or not. And then we have unable to determine, which is when it's kind of 50-50. Maybe the abuse or neglect did happen, maybe it didn't, but we really don't have enough to decide one way or the other. Then it would be ruled unable to determine. So for the state of Texas for fiscal year 2020, our total investigations were 154,593. We were able to confirm abuse or neglect in 42,717 of those investigations. We did not confirm abuse or neglect in 111,876. And of those investigations, we had 68,461 confirmed victims of abuse or neglect. So these numbers are just for Region 3. For fiscal year 2020, Region 3 is pretty big. I want to say it's the biggest region in the state of Texas. It includes Fort Worth, Dallas, and then all of the little outlying counties kind of west of Fort Worth, as well as east of Dallas. So it's a pretty big area. So for us, we had a total confirmed 20,077 cases of abuse or neglect. Of those, 2,048 were physical abuse, 1,788 were sexual abuse. We had 94 emotional abuse, 46 cases of abandonment. There were 11 labor or sex trafficking cases, 236 were medical neglect, 591 were physical neglect, and we had 16,849 for neglectful supervision. And then there's refusal to accept parental responsibility, and we had 164 of those. So usually neglectful supervision is going to be our biggest one that we see most frequently and is probably confirmed most frequently. That would be your cases for, sometimes it's drug use or substance use by the parents. Sometimes it's that maybe they were asleep and the child got out, escaped, went to the freeway. It can be a whole multitude of different things, but that's typically the one that we see the most. So some of the most common that we saw for fiscal year 2020, as I talked about earlier, medical personnel was our top reporter, and that was at 18.6%. We had neglectful supervision was our most confirmed allegation at 56,395. Usually the perpetrator of abuse or neglect is going to be the parent. That was 41,975. They're usually female and between the ages of 26 to 35. So after CPS investigates or CPI investigates, some of the different things we can do, we can either close the case because the abuse or neglect did not happen. We can close it and just, even if the abuse or neglect did happen, we can say that we have kind of mitigated the risk. We can find that it was so severe, or we can't, it's not something that we can work with the family on quickly. And in that case, we do take custody of the children. And then we also have what's called family-based safety services, who works with the families while the children are still typically placed in their home and there's no legal intervention that has taken place. So some more statistics for the state of Texas. You can see our child population is 7,515,129. In Region 3, we have 2,037,670 children in our population. For Tarrant County, it's 541,243 child population. The CPS confirmed victims were 68,461, and we had 8,093 removals, where we took legal intervention and removed the children from their home. Abuse and neglect fatalities do happen. Obviously, it's a tragedy whenever a child dies because of abuse or neglect. We have developed both internal and external mechanisms to review these fatalities. So we have citizen review teams, child fatality review teams, CPS, child safety specialists, regional CPS, child death review committees, and the state child safety review committee. And all of these groups review child deaths. Each of them kind of do it for a unique purpose, but the common goal is kind of to try and help CPS determine what might be causing the child fatalities, where they need to kind of strengthen some of their community resources and look at trying to prevent those child fatalities. Some of the things that we have to keep in mind when we're investigating abuse or neglect and taking action with families is we always want to make sure that we've taken into account the child's vulnerability, so their age and development. Obviously, younger children who are not verbal are more at risk for abuse or neglect. Also, disabled children would be more likely to be abused and neglected, especially those that are nonverbal. So we always have to take a look at the whole picture. How old is the kid? Can they call for help? Do they have the means to tell someone what's going on? Do they have a support system in place that they could tell? Something else that we look at is the home and social environment. So we look for safety in the home. We review the homes for safety, make sure that the children have a safe place to sleep, that the home is clean and free of any sort of safety hazards or, infestations that might cause issues with children or people living in the home. We also have to take into account the caregiver's capability. So what are their knowledge and skills? Are they able to care for children? Sometimes some of our parents just need a little bit of education. A lot of what we see is generational. So sometimes it's that they didn't really have parents that showed them how to be a good parent. So we try to help them become a good parent. We look at the quality of care, is it emotionally or physically harmful to the child? We do look at the patterns to see if there's a trend or, if we keep getting cases for the same thing on the same family, like what do we need to do differently? Obviously something's not working. We look at the parent or the caregiver's response to CPS. Are they willing to cooperate? Do they want to work with us, or are they trying to deceive us and not really work with us on much of anything? And then we look at their protective capacities. Are they willing to enlist the help of like maybe a family member or a friend that could come in and make sure the kids are safe? Are they willing to leave an abusive situation? Things like that. So all of those things come into play when we are thinking about child safety. These are just some different contact phone numbers and websites. So obviously I have the Texas Abuse Hotline on here and the website where you can make a report. There's the APS Facility Investigations, Foster Care Adoption Inquiry Line, Child Care Information, Office of Consumer Affairs, which is where you would go if you ever wanted to make a complaint about a CPS worker. The Texas Runaway Hotline, and the Texas Youth Hotline. These are some other websites that might be useful, some of the same ones, but just different community resources that we have that you can take a look at if you need to.